Okay. Um, One thing I don't know if I addressed is when you approach the residents, you want to ask, is it okay if I give you a little foot massage or hand massage, just so they're aware that you're going to be touching them. And some will acknowledge you, obviously, and some not. But I always like to say, is it okay if I give you a hand massage, and just at least let them know what I'm going to do. Again, we're checking for any bruises. Here she has a big bruise on her arm. You generally do not want to massage a bruise. That's a contraindication for massage. That's a blood clot, basically. I mean, a form of. And pressing on it, you don't never know if there is a blood clot in there, and you could dislodge it, and it could shoot into her heart or lungs and could kill her. So you have to be very careful on rubbing bruises. The color of the bruise, once it turns kind of yellow-green, then generally it's pretty safe. But if it's purple and rather new, you want to stay off of it. And it obviously doesn't feel good to push on it either, so they're not getting any enjoyment. So you want to stay clear of those, okay? Again, just applying gentle cream and long strokes. And how I like to do the hand to start off with is like if you were kneading bread. You just take a ball of dough and you just go hand to hand to hand, back and forth. Just getting their hand to relax. And then just bring out the fingers nice and gently. Again, a lot will have arthritis in the joints. You want to be very, very careful not to squeeze hard on the joints. I'm just gently massaging the tissue down the fingers. And then it feels good just to put just a little pressure on those fingertips. Just little rocking motions. And then we're just going to rotate her hand over, if she'll let me. And this is called the thenar pad, the ball of the thumb, and that feels really good, and you can just rub right into that pad. Again, the fibers are going this direction. Just follow the fibers. If you feel bumps, you want to gently press in, and then remember that straw, and you rotate back and forth over that straw to break it down. And again, finish with some nice long strokes. I like to spread the palm apart like this. Again, all the tissues fibers are going this direction. Just want to open that up. Because a lot of times their hands will just sit like this, or they're tight. It just feels good just to get it to spread open. And the spot right in between the thumb is amygdala. It's a spot where you can gently press that resets the nerves in the body. It's in Chinese medicine. Sometimes it's a little sharp, so I do it very, very gently, just to add some pressure. It's right when you squeeze your hand together, right where the top of the crease there. And then you move on.
Can I ask you something?
Yes.
Is that good for anxiety release?
Yes.
If you were to do that?
Yes.
Okay.
However, again, pressure is very gentle.
Okay.
If you were to probably have it done yourself, they would squeeze pretty hard where you get that electrical charge where it's kind of like, woo, you can do it on each other and you'll see it.
Okay.
And it's probably a good way to learn, to know how much pressure you should do it if you do it on each other. I like to also rub in a little webbing between the fingers. This tissue right in here, it feels really good. It's between the joints. And as you can see, all the bones popping up here. So gently in between the bones. Again, not pressing on the bones, because we're massaging the muscles, not the joints and the bones. The muscles do attach to the bone, so you're basically getting the sides of it as you go in between. Coming up a little bit to the wrist, all these muscles go through the wrist, right through this little canal here. So this right in this spot feels amazing. And I call this is thumb over thumb, where I'm just taking a thumb over thumb over thumb, and just sit repeatedly doing this. It's a very relaxing feeling. And then you work up to a gentle long stroke again to the forearm, up to the bend of the elbow.
Lavana's, oh, sorry. I didn't see Katie hiding over there.
And as you go up the forearm, the muscles get larger. They're thin down here and they get larger. Crazy. That's why your arm gets larger up here. It's very tender up here when it attaches. So you'll go up here and you may see, oh, I feel some of that fullness, that thickness that I was speaking of earlier. So there is some there. And again, you just want to be very gentle. See, it's causing her to move her hand around, because it's sometimes can be very tender. And you have to also, because she did that, I'm aware that it's tender. When you just have to listen to their body, look at their expression on their face, any kind of body movements will let you know if something's okay. Generally, if they move, it was something like that struck out. So you want to be very careful. And again, finishing with those long, loving strokes.